We've all taken the journey you're now beginning.
And thanks to the quality care at Trinity Mother Francis,
we are all survivors.
My journey with breast cancer began when I felt a lump during a monthly breast self-exam.
My journey began when my annual screening mammogram showed a suspicious shadow.
And mine began when I found discharge from my left nipple.
Dr. Larinaga of the Ross Breast Center was so kind and compassionate when he delivered the preliminary diagnosis. Even the ultrasound technician was patting my arm when she saw my tears. Every health professional that I came into contact with was so kind and compassionate.
I agree. Everybody at Trinity Mother Francis takes a true interest in you. I have such great confidence in the breast radiologist at Mother Francis. They read only breast mammograms and 24,000 screening mammograms a year. And they perform over 1,000 breast biopsies a year. So they know what they're looking at. And they're very good about explaining the procedures they'll perform and why they're performing them. When the breast radiologist called me at my home, I spent 45 minutes on the phone with them just asking questions, and that was like at 6 o'clock at night.
I appreciate the advanced digital technology at the Ross Breast Center. It allowed me to have my follow-up imaging studies and a core biopsy performed right here in Tyler. And as a mother, that's important.
I agree. With so many tests to have to go through, it's really nice to stay close to home. I even asked Dr. Larinaga if I should consider going to Houston, and he advised me that I could receive the same type of care right here in Tyler, and I'm so glad I did. I can't imagine having to go through the extra trouble of travel and the difficulty of being away from home to go through everything we go through.
I've talked to friends that have been to Houston and Dallas for their breast cancer treatments, and none had the experience that I had here in Tyler. The doctors really take the time to sit down and explain everything to you and make you feel really comfortable.
I feel exactly the same way. Dr. Larinaga did my biopsy, and before the results came in, he said he was pretty sure it was cancer. So he called me, and he was so caring and compassionate when he told me the diagnosis, and I literally fell to the ground crying. I was only 35 at the time. I'm someone's wife, I'm someone's mother, daughter, I'm someone's friend, and this cancer was not going to kill me. And because of the care I received at Trinity Mother Francis, I believe that's why I'm here today, and God had a hand in it. And without them, none of us would be here, I believe.
My first appointment was with Dr. Norton, the surgeon, and he was so comforting. I had 2 different tumors in 2 different quadrants, and the breast radiologist said that I had a fast-growing cancer, so I made the very personal choice to have a double mastectomy. I was concerned about where the lines would be, especially wearing a swimsuit, and Dr. Norton went through everything and showed me how it would look, and I felt so comfortable. And knowing that about the advanced surgical technology he would be using, I felt just fine.
My surgeon was Dr. McGehee, and he mentally prepared me for surgery, so I knew exactly what to expect. Maybe it's because their team of surgeons perform hundreds of breast cancer surgeries each year, but it felt like he anticipated all of my questions, and he made me feel like I was the only person having surgery that day.
My first appointment was with Dr. Vukaya at Texas Oncology, Tyler. I remember how many ifs I had with all of the treatment options. She explained them, but then I had to go home and think about them. We didn't know yet all of my treatment because I didn't know if the cancer had spread into my lymph nodes. But by the time I had met with my surgeon, I had decided to do a double mastectomy, and he was in full agreement.
My first appointment was at Texas Oncology with Dr. Saunders, and I had already decided that I was having a double mastectomy because of my aggressive cancer. And when I met with him, he said his services would not be needed. So he took my hands and he prayed with me. And right then I knew that I was in the best place with the best service that could be offered.
Faith-based care made all the difference for me and my family. Even my surgeon prayed with us before my surgery, and it made all the difference. It's not a clinical experience at Trinity Mother Francis, it's a healing one.
That is so true. They have such amazing doctors and nurses, and the facilities are absolutely amazing.
And there's so many others behind the scenes, like the pathologist who analyze breast biopsies, like 500 annually. I recently learned that these pathologists have 2 doctors that are fellowship trained in breast pathology, and that's pretty specialized training.
Dr. Casas, the medical geneticist, she did testing to see if my breast cancer had a genetic link, and luckily I do not have that gene.
I had the same experience. As a mom and a sister, I wanted to know if I carried the gene for breast cancer. Dr. Casas personally called me to tell me I was negative for the gene. She was just as excited as me.
It's so comforting to have this giant team supporting us on our breast cancer journey. I even remember Dr. Vukaya talking to me about the nationwide U.S. Oncology team that were helping to shape my plan.
She talked to me about that too, and as we talked about the patients are given the opportunity to participate in clinical trials if they want to, and it's like you have the national resources and the team of doctors at Trinity Mother Frances with Texas Oncology, and each week these specialists meet in a tumor conference and they discuss the best treatment for you.
And part of that team includes the wonderful cosmetic surgeons who perform over 100 breast cancer reconstruction procedures a year. My cosmetic surgeon was Dr. Saar. It was really comforting to know that he would be in surgery with Dr. Norton. Dr. Saar said the two of them would work together on the incision to get me the best outcome. Dr. Saar was thorough in explaining to me all the details of how he would do my reconstruction. He showed me the tissue expanders he would put in after the mastectomy and what to expect after the surgery. He showed me the breast implants and the saline. He's a perfectionist. He just puts you at ease when you talk to him.
My cosmetic surgeon is Dr. Laura O'Halloran. She was an absolute lifesaver. She knows how important breasts are to a woman, and she puts you back together again. I look better now than I did before my double mastectomy. And no one knows I had breast cancer unless I tell them I did. I can even wear a swimsuit.
Dr. O'Halloran was my cosmetic surgeon too. She was so kind and calm and reassuring. She drew pictures of what the surgery would be so I would understand, and she showed me an implant so I would understand, and she explained why she recommended that particular type, and I cannot say enough good things about her.
We are so fortunate to have Trinity Mother Frances here in East Texas. The physicians are so skilled and caring. The facilities are state-of-the-art, and all the healthcare providers are always thinking about what's best for you.
I tell people all the time that Trinity Mother Frances is the best place to go. The care I received was amazing.
We are so blessed to have them here in East Texas. I really can't imagine any place being more caring.
I'm Lori Bell, and thanks to Trinity Mother Frances, I've been cancer-free since 2009.
I'm Gina Wilganowski, and because of Trinity Mother Frances, I've been cancer-free since 2009.
I'm Ann Berman, and because of the quality and compassionate care at Trinity Mother Frances, I've been cancer-free since 2009.
We are survivors.